Good evening, everyone. Welcome to the Board of Health PPLER meeting, as they call it. I'd like to call the meeting to order. So we'll start with a land acknowledgement. Before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850, and that we are all treaty people. This land is a traditional territory of the Anishinaabe people, and is also part of the unceded territory of Algonquin Nation. But also, I'd like to acknowledge the Métis historical presence in this region. I encourage everyone to think about how they may contribute to the process of reconciliation. I'd like to take a moment to introduce our new staff. A new member of health, Dr. Carol Timbalani.
Oh, yeah, I'll introduce our new staff member, who is Nellie Bathello. She is our new executive assistant for the Office of the MOH, as well as for the Board of Health and the executive team. And you've probably had some emails from her, as well as invitations to the meeting, so you'll be interacting much more with her in the future. And as well, I want to welcome Tim Shepard to the Board of Health. Tim Shepard comes with quite a bit of experience with the OPP, especially in emergency management. So I think Tim will be a valuable addition to the Board of Health. So welcome both.
I might add, he's an amazing volunteer and a hell of a barbecue.
Ah.
A lot of time the council will do a lot of work with the team.
Oh.
Great. So I'd like to propose a motion for the approval of the agenda. So do I have a mover?
I'll move.
Thank you. Seconder?
I'll second it.
Recorded vote for so I'll call for recorded vote for the agenda. Rick?
Yay.
Karen?
Yes.
Blair?
Yes.
Gary? Gary Dexter? Online maybe?
I don't see him.
Sarah?
Here.
Okay you okay with the agenda?
Yes.
Okay. Okay. I'm okay with it. Jamie McGarvey?
Thank you.
Okay. Marianne Strickland?
Yes.
Thank you. Dave Wolf?
Yes.
And Tim Shepard?
Yes.
No, that's carried. Any conflict of interest to declare? Nope, seeing none. Okay, so let's go to the approval of the previous minutes. Changes. We'll have to go for that as well. Okay. So, Rick?
Yes.
Okay, sorry. We resolved the personnel policy, labor, and employee relations committee meeting held on April 26, 2023, be approved as presented. Okay?
Yes.
Do you have a mover? Need a mover and a second.
Oh, sorry.
I'll move.
All right. Seconder? Tim?
Sure.
There we go.
Yeah, I second this.
Rick, sorry.
Yes.
Karen?
Yes.
Blair?
Yes.
Gary? Okay. Sarah? You good?
Yes.
You good? Jamie McGarvey? Okay. Marianne Strickland?
Yes.
Thank you. Dave Wolf?
Yes.
And Tim Shepherd.
Yes.
That's carried. Another motion that the in-camera minutes from the Personnel Policy and Labor Employee Relations Committee, meeting held on April 26th, be approved as presented. Do I have a mover? Steve Wolf. Seconder. Sarah Inch.
Sure, I will second that.
I recorded vote. Rick.
Yes.
Karen.
Yes.
Blair.
Yes.
Gary? Okay. Sarah? Jamie, yep. Jamie McGarvey?
Yeah, can you hear me?
Perfect.
Oh, okay,
Hey, Jamie.
Hi, how's everybody?
very good.
Good to see you.
Marianne Sticklin?
Yes.
Steve Wolf?
Yes. Yes.
And Tim Shepherd?
Yes.
That's carried. All right. Another one. Date of the next meeting is, we'll give a call to chair. Business arising, there are none, is none. In camera, personal matter. Okay, so where's this, is that, yeah.
Okay, you have to read things.
Okay. That the, Personnel Policy, Labor and Employee Relations Committee move in camera at 12. Discuss item 8.1, the personnel matter about an identifiable individual. Do I have a mover?
I'll move it.
Rick? Second, Dave?
Yes.
Okay. Yes, Rick? Karen?
Yes.
Blair?
Yes.
You? Gary? Sarah?
Yes.
Yes. Jamie?
Yes,
Thank you. Marianne Sticklin?
Yes.
Thank you. Dave Wolf?
Yes.
Kim?
Yes.
Carrie?
forget.
I'm not getting
Well, I guess the next meeting will be decided anyway, because it'll be August 16th.
Welcome.
Thank you.
Okay, so therefore, let it be resolved that the Personnel Policy, Labor, and Employee Relations Committee recommends that the Board of Health approve the creation of an ad hoc committee of the Board of Health called the Employee Contract Negotiations Medical Officer, Health Executive Officer Ad hoc Committee. The personnel, okay, and the chair of the Personnel Policy, Labor, Employee Relations Committee will call a meeting in August to review the draft contract with the PPLER committee and for approval by the Board of Health. All right, so we have a mover?
Yeah.
Oh, that's furthermore?
Yeah.
Okay. Oh, I see, okay. Furthermore, let it be resolved that Personnel Policy, Labor, Employee. Okay. Okay, we're rewinding. Furthermore, let it be resolved that the Personnel Policy, Labor, Employee Relations Committee recommends the Board of Health approve remuneration of activities related to the ad hoc committee in accordance with the Board of Health, number B-F-004-remuneration. Oh my God. Remuneration, Board of Health members. Okay. Okay. Furthermore, that the Personnel Policy, Labor, and Employee Relations Committee recommends that the Board of Health approve the following members of the Employment Contract Negotiations Medical Officer of Health Executive Officer Ad hoc Committee, Jose Lane, Rick Champagne, and Jamie Lauer. Mover, Dave. Seconder,
Karen.
Karen. Go through again. Rick,
Yay.
Karen,
Yes.
Blair,
Yes.
Gary. Sarah,
Yes.
Jamie McGarvey,
Yes.
Mary Ann,
Yes.
Dave Wolf,
Yes.
and Tim Shepherd.
Yes.
That's good. Thank you. New business, there is none. If somebody wants to bring some new business, Dave? An adjournment, all right.
No.
All right. 5:37, where's that gonna be? Call the, is that? Adjourned at 5:37. I promise to crack with remuneration. Itinerary.
You have to redo it again?
I thought you say, but I'm gonna go. No. And I'd like to, but I gotta go. Bye, Jose.
Thank you, Jose.
Thank you.
I'd love to stay, but I'm going. Oh, thank you, thank you.
We'd love it if you'd stay.
I'm sure it'll be. Have a good evening.
Thank you,
Thank
Jose.
you.
Thank you.
Nice long weekend.
We're back on live.
Marianne,
Yes?
are you ready to go ahead with the?
Yes, I am.
Okay.
I was just waiting. I didn't want to jump the gun. Apologies for
Perfect,
not
thank
being there in person or online. Our internet is just too wobbly. So we'll call the meeting of the Finance and Property Committee to order at 5:40. And moving to 2.0, approval of the agenda. I'm looking for someone to move. Please just state your name.
It's Jamie. I'll move that.
Thank you,
Jamie
Jamie.
M.
And a seconder?
Jamie. I'll move. Sorry.
Okay, thank you. Be it resolved that the Finance and Property Committee agenda dated June the 28th, 2023 be approved. Going for a recorded vote, Rick?
Yes.
Karen?
Yes.
Blair?
Yes.
Gary? Sarah?
Yes.
Jimmy Lowry?
Yes.
Jamie McGarvey?
Yes.
Myself, yes. Dave Wolf?
Yes.
Tim Shepard?
Yes.
Motion is passed. Are there any declarations of conflict of interest? Hearing none, we'll move to 4.0, approval of the previous minutes. I'm looking for a mover.
Dave Wolf,
This minute?
sorry.
Pardon?
Rick Champagne for the first set of minutes.
Okay.
And Dave Wolf.
Thank you. Are there any errors or omissions noted? Hearing none, be it resolved that the minutes from the Finance and Property Committee meeting held on April the 26th, 2023 be approved as presented. Rick?
Yes.
Karen?
Yes.
Blair?
Yes.
Gary Gunther? Sarah Inch?
Yes.
Jimmy Lowry?
Yes.
Jamie McGarvey?
Yes.
Myself, yes. Marianne Stickland. Dave Wolf?
Yes.
Tim Shepard?
Yes.
Thank you. The motion is carried. Moving to item 4.2, which is the in-camera minutes from April the 26th. I would be looking for someone to move the resolution.
I'll move it, Marianne's, Jamie.
Thank you. Seconded by?
Karen?
Thank you. Be it resolved that the in-camera minutes from the Finance and Property Committee meeting held on April the 26th, 2023 be approved as presented. Were there any errors or omissions? None noted. We'll go to a recorded vote. Rick?
Yes.
Karen?
Yes.
Blair?
Yes.
Gary? Sarah?
Yes.
Jamie Lowry?
Yes.
Jamie McGarvey?
Yes.
Myself, yes. Dave?
Yes.
Tim?
Yes.
Thank you. The motion is carried. Moving on to date of next meeting is scheduled for April the 27th. It'll be live streamed from 345 Oak Street, North Bay.
September 27th.
Pardon?
September.
Oh, what did I say?
April.
You said April.
No. Apologies. I've had bad days. It's September the 27th, 2023, live stream from 345 Oak Street, North Bay. 6.0, business arising. There is none. 7.0 under new business. I would think that Isabel will be speaking to 7.1 and 7.2, the quarterly reports.
Okay. Good evening, everyone. I'm, just let me find them before I start. Okay. I'm working on a small laptop tonight, so I'm a bit of a disadvantage. I'm presenting tonight the quarterly reports for March 31st. These are for your information, and I'm happy to answer any questions on them if anyone has any. The first quarter of the year is not always too insightful because there's, you know, there's things hung over from the year before and whatever, but things are a bit back more to normal than they have been in prior years. I would draw to your attention the last page of the document, which has, excuse me a minute, I just gotta get the right page. Which is the COVID expenses. Just so you're aware, this year, the ministry, through Treasury Board, has decided that they're not pre-funding any COVID expenses. So we've been told that we won't get any payments for COVID until such time as we submit our second quarter report, which presently is due at the end of July. At the end of March, the total expenses owing to us from the ministry for COVID are the $364,000. And then we'll have the next quarter added to that, and that's what we'll submit. And hopefully we get it before the end of September, because it usually takes 2 or 3 months to get something approved. And other than that, yes, is there any questions? Okay, seeing none, I'll move on to the second part. The MOH expenses. Since these expenses are all prior to Dr. Zimbalati, these are Dr. Cherico's expenses from the January to March. We'll continue, so there'll be an overlap at some point in the year here, but these expense accounts will just start taking on Dr. Zimbalati's expenses as she incurs them. Any questions about that?
What did he have at Thai Palace?
I wasn't there, can't say.
One quick question. The Toronto Star subscription, is that a digital subscription or is it a hard copy?
I believe it's a digital one. Yeah.
Sorry?
It's a digital.
It is a digital one? Okay, thank you.
Okay. Yeah.
Okay, hearing none, we will, which I believe, Isabel, is yours as well, the risk management assessment.
Yes, I'll proceed with this. So the briefing note you have before you, this is also for your information. There's not really anything to approve, but to understand the process that we go through and the requirement by the ministry to actually have a risk management process. It is part of the public health standards and the ministry accountability framework. And it is required for us to report on these risks to you annually and to the ministry annually. Normally we would report on this in as part of the third quarter report. So at the end of September, we will report on those that are considered high risk through the process. So we have, this has been a capacity issue during COVID, so we really haven't done this formal process in quite some time. So we're just getting call it ramped up again. We did have a meeting recently to assess. We went over all the old assessments and kind of updated them and closed anything that seemed to be out of date. And you see that the 5 of what are considered high risks are listed in the document. And then we did do a bit of an evaluation of just the process and decided to carry on with the way we've been doing it. And we did a prioritization kind of process on what we should do next and what we should evaluate next. So the very last things and the next steps at the end are the 5 topics that we intend over the next year to get an evaluation done and documented in the system. And we'll bring the results of those back at this time next year. Is there any questions?
Okay. Thank you, Isabel, for all your work and providing all that information to the board. Most appreciated. Thank you.
No problem.
Moving to 7 point, Parry Sound Facilities relocation. I'm not sure if Rick or Dr. Zimbalati, someone will speak to that.
I can speak to it. Most of the information is in the briefing note, but I do have a bit of an update. So just in brief, for the new space in Parry Sound, a general contractor has been chosen by the owner, and so we can move forward now with work on the property. The estimated handover date is September 21st. This is a bit delayed than what we had initially anticipated, but we also anticipated there could be delays. So this isn't necessarily the moving date, but we do expect the moving date to occur very shortly thereafter. And our experience with moving into this building indicates that it can be done very efficiently. And really the moving into this building took 3 days. So we're expecting that it will be quite quick. And then, of course, once the equipment is there, then it will take some setup time for programs to get the equipment set up as they wish. So we're anticipating perhaps there might be at most a week in terms of service interruption at the Parry Sound office. So to go with the move, there is also a communication plan, both internal and external, so that both community members and staff are prepared for the move and can weather it with as few interruptions as possible. I can provide a bit of an update too on the work that has been done to date. This report is a few days old. I was hoping to have an update from today, but as of a few days ago, framing has started and is at about 30% complete. Plumbing is about 15% complete in terms of the distribution of the plumbing. The HVAC system measurements are complete for that, and the units are in production, and the installation is scheduled for next week, and the electrical is about 10% complete. So any questions on the Parry Sound relocation?
I'm sure we can keep an update too, as we go along, even send out an email once in a while, let us know where we're at.
Certainly.
Yeah, and that way we can all be part of the process.
Yeah, we will have our manager of facilities operations attending in person starting on July 5th. So he's going to be taking pictures as well. So yes, we will be able to provide regular updates.
Thank you. Great job. Great job. I know it's been a lot of work getting into this and getting the contract signed and getting your everything done.
Well, that was mainly my predecessors. I can't really take credit for that.
Yeah.
Also, our manager for facilities operations has been very busy with this, as well as the whole facilities operations team.
Yeah. thank them for us. Thank you.
And great news for Perry Sound as well. I think everybody's looking forward to the expanded location. Are there any other questions for Dr. Zimbalati? No, hearing none. Then we will now move into the in-camera session. So I am looking for someone to move the resolution.
I'll move it, Rick Champagne.
Okay, and a seconder?
Dave Wolf, I'll second.
Okay.
Thank you. Now therefore be it resolved that the Finance and Property Committee move into in-camera at 5:55 p.m. to discuss agenda item number 8.1, personal matter about an identifiable individual. Recorded vote, Rick?
Yes. Oh,
It's not about an
No, it's a security issue.
identifiable.
The wrong.
Sorry, we might have the package a bit wrong. but-
financial implications.
Yes,
The security of the property.
yes.
Say that again, please.
The in-camera
I
session is
I
regarding
might have the
security.
wrong. Okay, please read the resolution again, because with this, I'm just reading what my copy says.
Okay,
And
so
I'll
now
fix
therefore
the
be
next.
it resolved that the Finance and Property Committee move in camera at 5:55 to discuss item 8.1, the security and the property of the board.
Recorded vote, Rick?
Yes.
Karen?
Yes.
Blair?
Yes.
Gary? Sarah?
Yes.
Jamie Lowry?
Yes.
Anna McGarvey?
Yes.
Marianne, yes. Dave?
Yes.
Tim?
Yes.
Motion is carried. Are there any other comments, questions, areas of concern before we adjourn the Finance and Property Committee meeting? Hearing none, we will adjourn at 6:12 and turn the meeting over to our Board of Health Chair.
Good night, everyone.
Thank you.
Good night, Isabel. Thank you.
Night.
Okay, it would just be a couple minutes. There's got a couple directors going to be joining us, so we'll just give them 2 minutes to get on. Oh, I thought you were to ask me something.
Oh, yes, please.
Want to eat there, Scott?
Yeah.
Somebody want to eat? Oh, are we live? Oops, sorry.
There's Shannon. Right? We're good to go anytime you want.
Okay. Everyone back.
Yep.
Well, thank you, everybody, for coming out. We're going to start our regular meeting. We'll start with we'll call to order and approval of the agenda. We need a mover and a seconder, please.
I'll move. Karen?
Karen, second by Blair. Thank you. That's great. Be resolved that the Board of Health agenda dated June 2023 be approved. If any conflict of interest or anybody, let me know as we go along. So we'll have a recorded vote. Rick Champagne, yes. Karen Cook?
Yes.
Blair Flowers?
Yes.
I believe Gary's not on, right?
Correct.
Okay. Sarah Inch?
Yes.
Jamie Larry? JLo?
Yes.
Jamie McGarvey?
Yes.
Mary Strickland? Mary Ann? Dave Wolf?
Yes.
Tim Shepard?
Yes.
So it'd be carried. Conflict of interest, if something comes up or we don't see it and you think you should have a conflict, let us know as we go along. Approval of the previous minutes. Need a mover and a seconder?
I'll move.
Moved by Dave.
I'll second. Jamie McGarvey.
Jay McGarvey, thank you. Be resolved that the minutes from the Board of Health meeting held on April 26, 2023 be approved as presented. Rick Champagne, yes. Karen Cook?
Yes.
Blair Flowers? Yes. Sarah Inch?
Yes.
Jamie Larry?
Yes.
Jamie McGarvey?
Yes.
Mary Ann Strickland?
Yes.
Dave Wolf?
Yes.
Tim Shepard?
Yes.
Date of the next meeting will be September 27th, 2023. Oh, I missed a page or somewhere. Business arising, 6.0. This is resolution, or is this the wrong place?
No, that's not yet.
Okay, any business arising?
6.1, I think.
Yeah, 6.1, Dr. Zimbalati.
Okay, Dr. Zimbalati will report of the AGM at the conference 2023. Go ahead, Dr. Zimbalati.
Thank you. Rick Champagne and I attended the Alpha Symposium on June 12th. Just give you a brief overview of the conference. The keynote was given by Dr. Eileen Davila, who is the medical officer of health for Toronto Public Health. She took us through a journey back through the pandemic. I think it brought up some PTSD from a lot of the delegates at the meeting. But she did highlight some strengths that we have moving forward, and also some current and future challenges that we will and are already facing. The second speaker was Dr. Greg Mills, who is an exercise physiologist and author, and he gave a very interesting talk on neurophysiology, explaining how our brains and bodies are designed to operate in cycles of work and rest, and how we can make use of both to improve our health and well-being, as well as to improve our focus, our creativity, and our problem solving. I think this talk was a conference highlight for many delegates. Next, two researchers presented their findings related to the public health workforce, particularly during the pandemic. Dr. Jessica Hopkins from PHO presented findings from their September 2022 survey of the Canadian public health workforce, really reporting on significant levels of burnout, as well as exhaustion and disengagement. They also identified some protective factors that were identified. Well, they identified the protective factors that did improve or mitigate against burnout. Next, Julia Reutenberg, who is the General Manager and Chief Nursing Officer at York Regional Public Health, presented a rapid review of public health recovery. For this talk, she focused on the single theme of resilience. So her study really, or the rapid review, focused on 9 different themes. And with her research, she identified further interventions that public health can do to support their staff in recovery. And then at the Alpha Business meeting and resolution session, resolutions were passed regarding an amendment to the Constitution to increase the number of votes by PHUs with populations over 1 million. There are currently 3 such PHUs. There was a resolution recommending a renewed smoking and nicotine strategy in Ontario when advocating for strengthened building codes to prevent respiratory infections, and a resolution supporting AMO's call to action on housing and homelessness, and a call upon the province to work with Alpha, AMO, and partners to develop an action plan to end homelessness. And the final resolution was similar to the one that this Board of Health passed on monitoring food affordability and inadequacy of social assistance rates. And then that afternoon, delegates were led through a really efficient strategic planning session. for the 2024-2026 plan. And then Dr. Moore, who's the Chief Medical Officer of Health for Ontario, and Dr. Christopher Simpson, who's the Executive Vice President and Chief Medical Officer at Ontario Health, took part in a panel discussion on what's next following the pandemic. In this discussion, they recognized how well public health, acute care, and PHO scaled up quickly to respond to the pandemic. They also recognize that in future emergencies, the goal is to use sharper instruments as opposed to blunt instruments like lockdowns and school closures. They identified a need to move away from sick and disease care to health promotion and illness prevention. And this was Dr. Chris Simpson from OH saying this, so that was very encouraging. Data was also a large focus of the discussion, and primarily being able to collect and use quality and timely data. And Dr. Simpson indicated he wanted to move away from indicators of volume and focus instead on quality and effectiveness of interventions. And finally, mis and disinformation was highlighted as a key challenge affecting the health of populations. We need to turn this tide, but we likely haven't seen the peak yet of mis and disinformation. And at the end of the session, good news for us, Dr. Moore indicated that he expects that PHUs will have news on funding prior to the AMO conference in August. So fingers crossed on that. So section meetings occurred the following morning. So the Council of Medical Officers of Health and the Board of Health section separated into different groups. I'm happy to report a highlight of the COMO section was that the section did endorse granting emeritus status to Dr. Jim Chirico, and his contributions to public health were recognized. You know, just on a more personal note, I did find that the conference was very valuable. You know, it's very valuable to have the in-person conversations. And a lot of the participants, delegates, I hadn't met before, except on video, and it does make a real difference. However, there's no denying that in-person conferences are very costly to attend. And as well as some other MOHs, particularly northern MOHs, have and will continue to advocate for some sort of hybrid options to attend, so that some can, you know, occasionally you can attend in person, but there's also a virtual option, and perhaps using more creative ideas to simulate the informal chats and opportunities that occur at in-person conferences. And maybe I'll pass it over to Rick to report on the conference from his perspective.
Yeah, Dr. Zumblada, thank you. It's always an eye-opener, and you have an opportunity for brainstorming with other MOHs and also other Board of Health chairs. We all have the same problem at the end of the day. What was really interesting is when Dr. Moore and Dr. Simpson were speaking, we all know that public health, like during the pandemic, everybody did great work. There was no question about it, and everybody was, you know, waving at, you know, what their MOH did and what their 100%, or not 100% programs, but the programs they put in place during the pandemic. It was interesting. There was a lot of positive, but then I was the white elephant in the room and got up and asked a question, and which is I think my job is I asked them, should we be worried? And they kind of looked at me and I said, well, we know what public health does and we understand it 100%. They do great work. And now that you've got the year of the government, it's nice to find out what's going on, but the funding that we get is not enough. And they understood, and I said, I'm not here to blame you guys, because obviously they're here to represent us. And that's when Dr. Moore, I believe it was Dr. Moore, Dr. Simpson said, hopefully there's something coming up in August at the AMO conference. But again, it's like, it's nice that we understand how important public health is, but it's nice to, you know, the government of the day understanding that public health has to be funded. And the 70-30, I said, doesn't work. It should go back to the funding formula it was before. And hopefully that'll change when it comes to AMO. And talking to, well, actually a few of them got up and clapped and thought it was great, but I think at the end of the day is that we hear, even at the public health, we don't recognize what we do here. I don't think the public really understands what we do and how we went through the pandemic. And I think we got to get it out there to show the people what we've done during the pandemic. I don't know if we can get that out there or not, but a lot of people think the health unit does one thing, but we got to be proud of what we've done and proud of what the staff have done during the pandemic. You got a lot of the negative stuff that came out, but the positive is more important, and how we get that out there. And they were saying the same at other MOHs. So again, that's what I got out of it. It's nice to be in a room with the conference and saying what we've done, but we got to get out to the public somehow exactly what we've done and how we've done it. And I had a discussion with Morris today. That's why he gave me a call and said, "We'll be here tonight." And he thinks also maybe we should brainstorm ourselves to the next meeting. How do we promote our health unit during the pandemic to let them and let the public know exactly how good of a job they've done and how important they were?
So I can follow up from that, Rick, and let you know that Alpha and as well, it was mine primarily through Alpha. They produced an infographic as well as a report on all of the work that public health units did do during the pandemic to counter some of that disinformation and some of that negative commentary that public health was receiving. So I can forward those to the board, and perhaps could be something.
Which is nice. That's global. I mean, that's all Ontario, but for our own local. Like, we represent our local people and let them know exactly what we've done. We take the credit here, what's happening, but I don't think the staff gets the recognition, or the MOH gets the recognition they should be allowed to have. How do we get that out there? Because I don't seem to hear a lot of it. Even the media is only have one or two questions once in a while, but we got to get it out there that, what we've done and what we are doing. And if a pandemic ever happened again, how ready we are. Those are just my words, and that's what I got out of it from talking to other chairs. It was a very good conference as far as I'm concerned. I couldn't make Wednesday's meeting. I turned ill on Tuesday night, and so I couldn't make Wednesday. So anyway, that's my set on it. Thank you. Any questions? No. Good. And next one is a report of the medical officer of health.
Right, so I'll let the report speak for itself. It is in the package, but happy to answer any questions that arise from it.
Sure.
Go ahead, Dave.
Can you explain? I don't know what you are referencing when you say the Icelandic model.
Sure. Yeah. So this is a model that was developed in Iceland, I believe in 2009, in response to them seeing negative trends in their youth in terms of substance use. Primarily at the time it was more around alcohol and cigarette smoking, as well as a lack of connectivity to the home. As you know, Iceland is a Nordic country, and so in summer it's daylight all night, and so youth would be out all night, and street parties, that sort of thing. And so this is a model that is based on collecting evidence and using this robust evidence that is not just a sample of the population. It's surveying the entire youth population in a particular jurisdiction, which in Iceland's case was the whole of Iceland. And then using a very fast turnaround on that data to develop interventions at a community level. Some of the interventions that were developed in Iceland in response to the problems that they were seeing were things like having activity cards, so sponsoring youth to participate in after-school recreational activities that are supervised by an adult role model. So music lessons or chess club or athletics, whatever it may be. And they also had some other interventions, such as having more opportunities for parents to get together as a group so that all of the parents knew each other and then knew all of their each other's children, and so to create more community. And then there were some other interventions which perhaps would be more particular to Iceland and might not be as easily translatable, where they actually had curfews and parent patrols to enforce those curfews on youth. But that's not the crux of the model. The crux of the model is gathering the data and having that quick turnaround analysis of the data for communities to be able to action it. And so Planet Youth is the company that has, if you will, exported this model globally. And there are numerous jurisdictions across the globe that are implementing it. We do have some Canadian examples in New Brunswick, in Lanark County, in Calgary, where Planet Youth facilitates the development of communities and community partnerships. They provide the data collection, the means of data collection, they provide the data analysis, and then the facilitation in the community of, okay, now what do we do with this data? So, yeah, does that help answer your question?
Yeah, no, I thank you. So what if we were to pursue such a model? Have we done some sort of analysis to determine what the cost to us would be? Number one. Number two, would this be something that, did you say Lanark County?
Mm-hmm.
So it's already being done in Ontario?
Yes.
Okay, so we wouldn't be in line for example, a pilot study with the province. But is the province prepared to fund this kind of an initiative to determine what the benefits would be longer term?
So this is actually something that Public Health Agency of Canada is very interested in, and the Icelandic prevention model has been mentioned by Teresa Tam. In fact, I attended a conference where the president of Iceland came to Ottawa, and we had a panel discussion moderated by Teresa Tam on the Icelandic prevention model. So, and so Planet Youth was on the panel, as well as representatives from Calgary and Lanark who are implementing the model. So we haven't heard a lot at the provincial level about funding, but we do know that there are funds set aside at the federal level to support communities that are engaging in this project. In terms of the costs, the contract with Planet Youth for their work is you have to commit, first of all, to 5 years. And in terms of Canadian dollars, that contract costs in the range of $40,000.
Is that an annualized or for the entire 5 years?
That's for the entire 5 years.
Thank you.
And then there would be the additional cost for any intervention that as a community we decided to implement, as well as it is highly recommended that you do have a dedicated coordinator to do all this work with the communities. And so you're probably looking in the range of $100,000 annually for that.
So is this a proposal we can foresee bringing forward to the board?
So it's something that yeah, I think we're very, it could potentially come out of operating dollars or I think in terms of the contract costs, costs above that would hopefully be raised primarily, within the community. But if it is something that the board is interested in, I think, bringing a presentation on the Icelandic model to the board would be something that our Healthy Schools team would be very interested in doing. And just to let you know, this is something that we are looking at implementing across our region. However, municipalities have to want to sign on, and there's a question of whether we have different communities or we're one large community. I'll also mention that there are 2 other northern health units that are very interested in bringing this to their areas. And in fact, Porcupine, I believe, has already signed on with Planet Youth. So there's, potentially some collaboration that can happen there as well.
Is this a possibility that we could cost share with stakeholders in the community, for example, the school boards, for example?
Yes, there are. So, yes, and there are certain organizations who have already expressed an interest in providing funds towards this. So we have had expressions of interest. We did provide an orientation to the model back in February. We held a session in Parry Sound and a session in North Bay, and at the end of both of those sessions, we collected information from the participants on, what they're interested in providing, whether it be in kind, whether it be, support in terms of planning, whether it be financial support, and so we have interest expressed in all those categories.
Very good. Great question, Dave. Great answer, Dr. Zimba. It sounds like an interesting program, for sure.
Yeah,
Go ahead,
I was just wondering on that, like, what would the process be to kind of make that a priority? Like, do we do a notice of motion to sort of say, what are the steps we ask the medical officer to determine what the model would look like, or what the process would look like, and costs, and like kind of a bit of a business case to do some scoping of that program. It's great that you're kind of looking at it, but to look at and say, like, this would be very powerful in a community, because I've seen, similar things with seniors, for example, when you engage them and you programming and you get feedback from them, their health, it keeps them out of hospital, it keeps them out of long-term care. But to me, getting at youth early enough and that, to me, it fits right into your point. The mandate of the health unit is more prevention and education, and you want to stop it from happening before, instead of being reacting. So I don't know if there's a notice of motion that has to happen to make that a priority, or how that works. So
potentially, like, we can bring out like a detailed briefing note to the Board of Health, which may help facilitate some discussion. I also did want to mention too that this is a priority identified by the Child and Youth Planning Table. So they've identified 3 areas of focus. One being the Icelandic prevention model, another being positive parenting, and the final being addressing adverse childhood experiences. So this is something that the stakeholders in the community, and I believe Louise Gagne can correct me if I'm wrong, but I believe the Child and Youth Planning Table has membership across our district.
I believe Louise is on.
Yeah, Louise, did you want to jump in?
Yeah, thanks, Dr. Zimbalati. You've done a great job in answering all the questions. So as you mentioned, it is one of the priorities. So substance use prevention for children and youth is a priority for the Muskoka, Nipissing, Parry Sound Children and Youth Planning Table. It's a bit of a mouthful. And that table has membership from all different agencies across the district. And this is one of those priorities. And we will be leveraging community assets, the strength community, traditional and non-traditional partners to help advance the work on the Icelandic prevention model. One of the first critical steps was to achieve buy-in from our school boards, all 4 school boards that have schools within our both Nipissing and Parry Sound districts, because we really need their buy-in to collect data within the schools. And so we are close to obtaining that. And once we have those memorandums in place, then we can bring it back to all our community members to advance the next steps of talking about funding and establishing a coalition table, which will also include a youth advocacy table. So we want to have this model is to benefit youth in our community, and so we want to have their voices represented there as well. And we do have a business case that was put together around this model when we first brought it to the executive team at the health unit. And so we'd be happy to share any of that information in a briefing note, as well as do a presentation. And we also have a copy of a YouTube video of the presentation that we did to partners, both in the Parry Sound district as well as the Nipissing district, if you're interested in the long version of the presentation. So we're happy to pass those along following this meeting.
Also, Louise, without reinventing the wheel, you said South Porcupine, is it that bought in, or Porcupine?
Yes, so both Temiskaming and Porcupine health units are interested in this model, and they have great interest from their school boards as well. And particularly with Porcupine, we share some school boards that cross over, so that's great. Yes, so we are leveraging those partnerships within the north as well.
Okay. Any other questions?
I just have a quick question.
Yeah, go ahead, Karen.
Could you just tell us who some of the partners that you're talking about could be? Does that include the municipality? Is that somebody that does that group? Do they have to sign on, or who are some of the other partners, if you don't mind? When you talk about partnerships, I'm just wondering what groups are.
It's really, it can be municipalities. So we have had interest from the municipalities who attended the information sessions to contribute funding and resources. It's also your recreational partners. So, for example, the YMCA is very interested in this. Within Lanark County, it's actually being spearheaded by their Rotary Club there. So it doesn't always have to be led by public health. What we need is an organized group with the right partners involved who are servicing or engaging with youth, or have adults in the community that are working with youth.
Right. Thank you.
I guess the question is from Jamie is, what's our next step? Where do we go from here? I guess the answer would be.
So I think it'd be worth bringing a briefing note, but also a presentation to the Board of Health if you're interested in having a presentation.
Mm-hmm.
Are you proposing that we would lead this initiative? That's what I'm hearing. I just want to be clear. Are we bringing this forward for consideration? I know it's not for consideration, for information tonight from your report, but it seems to me that there are a lot of heads agreeing, nodding politely. And you said earlier that it's a quick turnaround from the data collection to implementation of various things, if I heard correctly, in this model. And my fear is at the other end, getting something started structurally can be very bureaucratic. So if we're looking at, if you're planning, Dr. Zimbalati, to recommend that The Board of Health would be the catalyst for this in our region. My suggestion would be that then bring the suggestion, bring the recommendation. I'd like to see things move faster. You're going to get more buy-in if we just move things along. Otherwise, they're going to sit and fester for a while. So my suggestion would be, for what it's worth, yes, I'd like more information. I'd like to see what the benefit of the model is and how we would apply it locally. And I say that in terms of our catchment area, but also perhaps a suggestion on an outline for how that would look if we were going to move forward with this, because we're getting to the point where we're going to have to start budgeting for next year. And if that's something that we want to discuss, I think we should have that in the back of our mind.
Yeah, sounds good then. I think we can include our recommended action in the briefing note. Yeah. And as Louise mentioned, we already have, developed a business case for this. Yes, you do need an organization to take the lead. You need an organization to actually sign the contract. But in terms of the funding for the interventions, and even for the coordinator role too, I think that's something that does not just, fall on the lead. And even, the startup costs in terms of the contract costs, that's something that can be established. So I think being the lead doesn't necessarily mean the costs fall on our shoulders.
Right, but it needs someone to start it.
Exactly.
Yeah, I agree with you.
Yeah, no, great comments, Dave, and hopefully sooner than later. Sarah?
I actually attended the Icelandic model presentation in North Bay, and I can endorse this program. It looked very good. They do collect data once a year through high school students. It was through cell phone surveys, I believe.
Every 2 years.
Every 2 years? Yeah. Well, maybe they would do once a year. But anyways, and I think that given some of the work we're doing over at City Hall, they would certainly be in support of this as well. So
it sounds like it's a worthwhile project, and I think, like you said, Dave, get on it before it festers too much and nothing gets done. So I do agree with that also. Any other comments on this item? Seeing none. Thank you, Dr. Zimbalati.
And thank you very much for your
support.
interest and your questions around the Icelandic model. It is something that I find very exciting, and so thank you.
Do you have anything else under your report?
No, I don't have anything to add. Thank you, Rick.
Chair, I had a couple of other questions, if
Sure.
I may.
Go ahead, Dave.
Just because I'm new to the board, if you'll indulge me.
Of course.
On page 7, quality issue reports,
yes.
QIR, it says a total of 11 QIRs were completed, et cetera, et cetera. And I'm just curious, it talks about the levels, and I don't know what a level 1 or a level 0 or a level 2 mean, and I'm wondering why that's important. You put it in your report. Obviously, it's something that we should be noting. Can you explain to me what those levels are and what they mean?
Sure. So the level 0 means that it was a near miss. There was a potential for something to happen, but it didn't actually, the error or the issue didn't actually occur. So there was no harm, there was no loss, no damage. Level 1 means, yes, the incident actually did occur, but there was no harm, loss, or damage. When you get into level 2, there was temporary or minor harm. And
so what kind of things are these what kind of incidents are these? I'm not asking for the particulars of an incident, but can you give me an example of what these are that we're reporting on here?
So for an example, it might have been, and I'm not saying that this would be a particular one that would have happened in this cycle, but a vaccine administration error where someone was given like a dose that, say, an adult dose instead of a child dose, or vice versa, and so we had to, it was identified and recall them and
So I guess where I'm leading to on this is if we get to a level 2 where there's temporary or minor harm, loss, damage, recovery of days, weeks, et cetera, is there also the potential for legal action?
I mean, with a level 2, I think the risk would be fairly low, but yes, as you increase in level, especially for level 3, then yes, there is
Okay.
potential.
Okay. Thank you, Chair. I had a couple of others after, but on that, I appreciate it. Thank you.
No problem. So on. Great question. Anybody else have any questions for Dr. Zimbalati? You have anything else, Dr. Zimbalati, in your report?
No, Rick, thank you.
No, thank you. So we'll go on to item 8.1, or committee reports. So I have a resolution here that was prepared earlier. I need for the PPLER. So I need a mover and a seconder.
I'll move it.
Jamie Larry. I need a seconder
Sorry, Chair, which resolution is this?
for the, we came out of the PPL.
So the creation of an ad hoc committee?
The ad hoc committee, sorry.
I
Sorry.
apologize. Yes, I'm happy to second.
My
That's what
fault.
I thought you were referring to, but I want.
Yeah, okay, sorry, my fault. Okay, so whereas Dr. Carol Zimbalati was appointed a full-time medical officer of health, executive officer for the North Bay Parry Sound District Health Unit by the Board of Health at the Board of Health meeting held on April 26, 2023, and whereas an employment contract needs to be negotiated between the health unit and Dr. Carol Zimbalati. Therefore, it is resolved that the Board of Health approves the creation of an ad hoc committee of the Board of Health called Employment Contract Negotiation, Medical Officer of Health, Executive Officer Ad hoc Committee, and that the chair of the Personnel Policy Labor Employee Relation Committee will be calling a meeting in August to review the draft contract with the PPLER committee and the approval by the MOH, or the Board of Health, sorry. It be furthermore the resolve that the Board of Health approves the following members of the Employment Contract Negotiation, Medical Officer of Health, Executive Officer, and Ad hoc Committee, Jose Goulet, myself, Rick Champagne, and Jamie Larry. Further, it be resolved that the Board of Health approves the remuneration of activities related to this ad hoc committee in accordance with the Board of Health Policy BF004, Remuneration Board of Health Members. I'm going to call for recorded vote. Rick Champagne, myself, yes. Karen Cook?
Yes.
Blair Flowers?
Yes.
Sarah Inch?
Yes.
J-Lo?
Yes.
Jamie McGarvey?
Yes.
Mary Ann Sticklin?
Yes.
David Wolf?
Yes.
Tim Shepard?
Yes.
Resolution or motion carried. Where am I? 9, correspondence. The Board of Health is listed, can be found on the Board of Health Teams folder. If anybody have any discussion on, I don't see any. New business. Look around the table. I don't see any. In camera. Adjournment. I'd like to thank everybody for coming out tonight. It was a long meeting and a lot of good discussion, and thank you, Dr. Zimbalati, for your report at the Alpha Conference. It was enlightening, and again, these issues we've been talking about is good for our district, and thank you again for everybody to come out.
Thank you.
So we'll adjourn. Thank you. Now, do we have no media?
There were no media questions according to,
See, again, that's what we talked about earlier, eh? It's just too bad not enough stuff gets out there, and then you don't have enough questions what we do and what.
Are you checking to see if there's any? Just in case.